I think first and foremost, she's clinically excellent, and I think that she brings a certain compassion and humanity to the bedside. The story that I wrote that was submitted for the award, we had a patient's family member who we passed one day on rounds who was sitting outside of the patient's room crying, sitting on the floor. And Becky noticed that they were alone, and she stopped and sat with the family member on the floor and held her hand because her loved one was being coded in the room nearby.
When I saw her, I just felt compelled to go and sit with her, and she told me all about her loved one who was her best friend for decades, and it really just made me think of my best friend.
When I asked her about it later, she just said no one should be alone while their best friend is dying. Becky is a clinical pharmacist that works with our acute care surgery teams.
The patients that I have on my services can range from gunshot wounds, stabbings, car accidents, explosions, burns. That's mainly for our trauma service. And then for emergency general surgery, we have people with cholecystitis, with bowel obstructions, with perforations, those types of things.
So she even will come down to the trauma bay with us. She'll come to see consults with us. She rounds with us and talks to the patients, especially when they have medication questions. But she does more than that too. She helps integrate new residents to the team. She helps integrate new medical students to the team and teaches them about some of our guidelines and protocols.
Definitely the most rewarding thing about my job is getting to interact with and teach residents, both medical and pharmacy. It's something that I truly, truly love about my job. I consider them all, my friends, my babies. I want them to learn all that I can teach them about pharmacy-related things so that they can go out and be the best surgeons and pharmacists that they can be.
I think Becky is a worthy UAMS MVP because of the clinical excellence and compassion that she combines when we have patients and family members who are maybe struggling or have questions. She's that bridge between the care team and the patients and their families to answer questions that they have, even questions that may not be directly related to their medications. She just goes above and beyond. She's always available. She's dependable. She's just an extremely invaluable team member.
So I was definitely shocked to be MVP. I go into every patient encounter thinking, if this were my family member, how would I want them to be treated, whether it's someone grieving during a code or someone that's lost on campus. And so I was very surprised to be recognized for this.